Hello, welcome to day 18 of our 10 daily medical questions. Today we are diving into the fascinating world of cardiology. From understanding the heart's anatomy to exploring treatments for common cardiovascular conditions. These questions will help you strengthen your knowledge of this critical system. Let's get started. 10 cardiology questions. Question 1. What is the primary mechanism of action of beta blockers in treating hypertension? Answer: reduction of heart rate and cardiac output. Beta blockers inhibit beta-adrenergic receptors, reducing sympathetic stimulation of the heart, lowering blood pressure and myocardial oxygen demand. Question 2. What is the first-line treatment for chronic heart failure with reduced ejection fraction? Answer: ACE inhibitors or ARBs, beta blockers, and mineralocorticoid receptor antagonist MRAs. These drugs improve survival by reducing afterload, preload, and myocardial remodeling, helping to manage heart failure symptoms and progression. Question 3. What does the P wave represent on an electrocardiogram? Answer: atrial depolarization. The P wave signifies the electrical activity of the atria as they contract to push blood into the ventricles. Question 4. What is the most common cause of sudden cardiac death in young athletes? Answer: hypertrophic cardiomyopathy, HCM. HCM is characterized by asymmetric thickening of the ventricular walls, leading to obstruction of blood flow and risk of arrhythmias. Question 5. Which type of heart block is characterized by progressive prolongation of the PR intervals until a beat is dropped? Answer: second degree AV block, Morbitz type 1, also known as Wenckebach. This block occurs due to intermittent failure of AV node conduction, leading to a predictable pattern of dropped QRS complexes. Question 6. Which heart condition is characterized by a water hammer pulse? Answer: aortic regurgitation. In aortic regurgitation, blood flows back into the left ventricle during diastole, leading to a bounding pulse felt as a water hammer. Question 7. What is the gold standard for diagnosing coronary artery disease? Answer: coronary angiography. Coronary angiography uses contrast dye and X-ray to visualize blockages in coronary arteries, providing definitive information about CAD. Question 8. What is the primary treatment for acute pulmonary edema caused by heart failure? Answer: loop diuretics like furosemide. Loop diuretics rapidly reduced fluid overload, improving pulmonary congestion and symptoms of dyspnea. Question 9. What is the most common congenital heart defect diagnosed in childhood? Answer: ventricular septal defect, VSD. VSD is the most frequently diagnosed congenital heart defect in infants and children. It is a defect in the interventricular septum, allowing abnormal blood flow between the ventricles. While small VSTs often close spontaneously, large VSTs may require surgical intervention. Question 10. What is the most common congenital heart defect detected in adults? Answer: atrial septal defect, ASD. ASD is often undetected in childhood due to its asymptomatic nature. Many cases are diagnosed later in life when complications like arrhythmias, heart failure, or embolic events arise, make it the most common congenital heart defect identified in adults. So, that concludes day 18 of our 10 daily medical questions. Cardiology is such an essential topic, and we hope today's questions helped clarify some key concepts. Don't forget to like, share, and subscribe to stay updated with our daily videos. If you have any questions or topics you would like us to cover, let's know in the comments. See you tomorrow for another round of medical learning.